My name is Gilia Newstead, and today we're going to look at a case study involving ductal carcinomas in situ presenting as non-mass enhancement using QuantX software. Disclosure, I am a medical consultant to Clarity Imaging and I serve on the advisory board of Medscape. This is the QuantX indication for use. Please see risk information at the end of this video. We're going to evaluate an asymptomatic 48-year-old female who presented screening mammography with calcifications in the posterior and superior and lateral aspect of the right breast. Diagnostic mammography with magnified views were done and found grouped calcifications in the upper outer quadrant of the right breast. Stereotactic biopsy yielded ductal carcinoma in situ, and MRI was recommended for evaluation of disease extent. Here is an example of the magnified views of the right breast, showing several small grouped area of calcifications in the upper outer posterior right breast, which you can see on the MLO view here and the CC view here. Stereotactic biopsy yielded ductal carcinoma in situ, cribriform micropapillary in type, and breast MRI was recommended for evaluation of extent of disease of ductal carcinoma in situ in this patient. Now we'll look at the MR examination. On this screen, we have the MIP image and we have the T2 weighted non-fat saturated pre-contrast images on the remaining windows. Let's start by looking at the MIP image, and we'll go full screen. And here we can see there's quite a lot of background parenchymal enhancement bilaterally, with more enhancement laterally in the right breast, which could represent non-mass enhancement, and we will look at that further on the post-contrast series. And we can scroll through the T2 weighted examination, and we can see a few little cysts, such as we can see here on the left, a few little cysts in the non-fat sat examination, but otherwise the T2 weighted images look fine. So we'll go to the post-contrast series next, and we'll see here on the post-contrast series the source images. We can scroll through axially. As we do this, we can see that in the lateral side of the right breast we have quite a bit of non-mass enhancement. It looks segmental, and if we're concerned about non-mass enhancement versus BPE, the subtraction imaging is probably the best way of looking at this. So let's look at the subtraction images, which will be the last hanging protocol here. And we can look at the axial image full screen. And here we can see a lot of lateral non-mass enhancement, extending actually from the posterior aspect of the breast all the way to the nipples. This is a segmental area of enhancement, and I like to thicken the slice a little bit when I think I'm working with non-mass enhancement, which could well represent DCIS. I'm going to thicken up the slice a little bit here, and here you can see the extent of the enhancement. This is a whole segment filled most likely with tumor. Non-mass enhancement probable DCIS will be the diagnosis here. We can get rid of this thickening of the slice here, and let's look at the kinetic overlay. And you can see that most of the kinetic overlay is persistent enhancement. There's a little bit of washout, but mostly persistent enhancement. So let's segment the lesion. We'll provide some more information. We'll click on a C point here. And here we see the segmentation now. You can see it's corresponding with the non-mass enhancement, a good segment of it. And now we can see the extent, the non-mass enhancement, very nicely segmented with low plateau persistent type enhancement. But we look at the artificial intelligence score of 65, which is in the malignant domain, well in the malignant domain. So this would all come together with a diagnosis of extensive segmental non-mass enhancement in the right breast, likely representing ductal carcinoma in situ. The final evaluation indicated extensive segmental non-mass enhancement in the right breast, extending from the posterior breast anteriorly to the nipple and involving the nipple. The final pathology at simple mastectomy yielded cribriform, papillary, and micropapillary DCIS, which was 7 centimeters in extent, with associated calcification, necrosis, and extension into the subareolar ducts. 2 foci of microinvasion were also identified, and the sampled axillary lymph nodes were negative for cancer. So in this case, MRI really showed that the disease extent was much larger than initially anticipated at the site of the mammographic study and necessitated therapeutic change with simple mastectomy. Indication. QuantX is indicated for the assessment and characterization of breast abnormalities from MRI data in patients presenting for high-risk screening, diagnostic imaging workup, or evaluation of extent of known disease. QuantX is not intended for primary interpretation of digital mammography images. QuantX is not intended for primary interpretation of digital mammography images. Labeling also provides information to users about potential limitation of the device related to specific subpopulations, for use by licensed healthcare professionals only.